However, today we shall discuss about larynx because larynx is a very big topic. So today we should discuss about larynx. তোদেরকে বলেছিলাম একটা ওই প্লাস্টিসিন কিনতে প্লাস্টিসিন কি জানিস প্লাস্টিসিন নরম কাদার মতো মোল্ড করা যায় ওইটা হলে মানে তোদেরকে ল্যারিংসটা খুব সুন্দরভাবে বোঝানো যেত এই ছবি দেখে কতটা বুঝবি জানি না কেন What is the function of larynx? Larynx in Bengali it is called ষড়যন্ত্র. So what is the function? Larynx a function key. What is the function of larynx? बोलो larynx का function क्या है? Voice, very good. That one, voice production. Number two, huh? This is the number one function. First function this is. Second function, respiration, phonation, etc. So larynx is so designed that it acts as a sphincter at the inlet of the respiratory tract. At the inlet of the respiratory tract. So it prevents, except for air, it prevents any foreign material to get introduced into the respiratory tract. বুঝতে পারি ব্যাপারটা সোজা বাংলায় it is a protective mechanism. Except for air, it doesn't allow any foreign material. If any foreign material tries to enter into the larynx, what will happen? কি হবে প্রথমত চোখে যদি বড় if bolus is big then it may choke আর if it is small খাবার ঢোকেনি কখনো larynx এ কি হয় violent cough reflex it is because of the larynx acts as a watchdog ডগের কাজ কি ওয়াচ করা ওয়াচ ডগ তার ফার্স্ট ফাংশন হচ্ছে ইট অ্যাক্টস অ্যাজ ওয়াচ ডগ ইট প্রিভেন্টস দ্য এন্ট্রি অফ এনি ফরেন মেটেরিয়াল এক্সেপ্ট এয়ার মনে থাকবে নেক্সট it helps in phonation it helps in respiration it helps in deglutition also very good so this is the function of the larynx now larynx is made up of this is the skeleton of larynx now skeleton of larynx what are the components of the skeleton of larynx number one component is cartilage Number one component is cartilage. Number two, membranes and ligaments. Number three, muscles. Number four, joints. So these are the components of laryngeal skeleton of larynx. Now, one by one, we shall discuss. First, cartilage of the larynx. How many cartilages are there in larynx? একটা নাম বল larynxের cartilageর নাম বল দেখো বলতে পারছিস না এতগুলো cartilage আছে thyroid cartilage প্রথম তো এত মোটা একটা cartilage thyroid cartilage মনে পড়ছে না thyroid cartilage নাও বলো আর কি কি cartilage আছে larynxে Larynx is formed of cartilage, membrane, ligaments, muscles, all these things. So now, laryngeal cartilage. How many cartilages there? Or at least name one of them. First, there are three unpaired cartilage and 3 paired cartilage. 3 unpaired cartilage. One is thyroid cartilage. Number 2, just below thyroid cartilage, is cricoid cartilage, and another is epiglottis. এখন থেকে হাই তুলছে আর কি, yawning. 3 paired cartilage, 3 unpaired cartilage. 3 unpaired cartilage, one হচ্ছে thyroid cartilage. Number 2, just below thyroid cartilage, cricoid cartilage. Number 3, epiglottis. Now come to the paired cartilage. There are 3 paired cartilages. Number 1, arytenoid cartilage. Number 2, corniculate. Number 3, cuneiform. So these are the 3 paired cartilage. Now what is the nature of this cartilage? It is fibrocartilage or hyaline cartilage or elastic cartilage? All are not hyaline. Number 1, thyroid cartilage is hyaline cartilage, cricoid cartilage hyaline cartilage, and arytenoid cartilage, partly hyaline, partly fibroelastic. Vocal, I am coming later on. And elastic cartilage is corniculate, cuneiform, and epiglottis. Corniculate, cuneiform, and epiglottis, they are elastic cartilage. You should be asked about this in the exam. I would love the nature of the cartilage. Now, after cartilage, come to the membrane, fibroelastic membrane. There are 2 fibroelastic membrane. Number 1, here you see the one thing I forgot to mention, that out of this cartilage, one cartilage is complete cartilage. Which one is complete cartilage? Which one is complete cartilage? Complete cartilage is cricoid cartilage, and other cartilages are not complete, they are incomplete. And cricoid cartilage form a complete ring, and it is the foundation stone of the larynx. So cricoid cartilage may come as a short note. Cricoid cartilage, it is the founding stone of the larynx. Now here you see, look at this picture. This membrane, it is stretching from the what is this? Hyoid bone, from hyoid to thyroid, that is thyrohyoid membrane. This is the thyrohyoid membrane, right? Thyrohyoid membrane is pierced by, এতে দেখেছো ডিসেকশনে, thyrohyoid membrane is pierced by which nerve? Thyrohyoid membrane is pierced by which nerve? Now next to, here you see, after that thyroid, this is the, here you see this ligament. What is the name of this ligament? It is between the thyroid cartilage and cricoid cartilage. So it should be thyroid and cricoid. So it should be cricothyroid membrane. And at the midline, this membrane condenses to form, when membrane condenses, it forms ligament. When membrane condenses, it forms ligament. So at the midline, it is known as thyrocricoid, median thyrocricoid ligament. And later part, it is known as cricovocal membrane. বাকি যেটা আছে, that is cricovocal membrane. বুঝে যাবি না, আর কিছু বুঝতে পারবি না। How vocal vocal ligament is formed. If you want to understand, you have to know this picture. Now here see at the midline, this cricothyroid ligament is attached to the lower margin of the thyroid cartilage here. Here it is the lower margin of thyroid cartilage, but laterally it enters into the neck by enters deep to the lower margin. It enters beneath the lower margin. The anterior portion is attached to the lower margin, but the lateral portion is not attached to the lower margin, but it proceeds further upwards deep to the lamina of the thyroid cartilage. This is called lamina. There are two lamina, and anteriorly it has formed like the V. It is called Adam's apple by thyroid prominence, right? Now come to the next ligament, that is, this is the cricoid and trachea, the cricotracheal membrane, right? So these are the membranes. Now come to the muscles. What are the muscles? Here you see, here one muscle you can see, and you have also seen your dissection cadaver. This is, what is the name of that muscle? What is the name of that muscle? See and tell me. What is the name of this muscle? This muscle, it is going from cricoid to thyroid. So it is cricothyroid muscle. This cricothyroid muscle is supplied by cricothyroid muscle. I am coming to this topic later. Cricothyroid muscle. Now you have to know the actually muscles of the thyroid, muscles of the larynx has been broadly divided into internal and external muscles. Internal muscles of the larynx and external muscles of the larynx. External larynx, again, it is subdivided by external muscle, again subdivided by the muscles which move the larynx, I mean thyroid cartilage, upwards. What are the muscles that moves the thyroid cartilage upwards? বলো, আচ্ছা ডিসেকশন ভুলে গেছি, ডিসেকশন তো করেছি, নেকের ডিসেকশন তো এতক্ষণ ধরে মাসল দেখলি, হ্যাঁ। সুপ্রাহাইড মাসলগুলো কি? সুপ্রাহাইড মাসলস, what are the name of the suprahyad muscles? Digastric, mylohyoid, আর প্রথমত পেছন থেকে স্টাইলোহায়োড, তারপরে এখান থেকে মাইলোহায়োড, তারপরে এখান থেকে জিনিওহায়োড, হ্যাঁ, ডাইগ্যাস্ট্রিক, এগুলো গেল সব। দিস মাসলস আর আউটসাইড দ্য laryngeal cavity, সেই জন্য এক্সট্রিনজিক মাসলস। এক্সট্রিনজিক মাসলের মধ্যে এগুলো পড়ছে, যেগুলো অ্যান্ড দে আর এলিভেটর অফ দ্য থাইরয়েড cartilage, and there are some muscles that depress করে. What are the muscles that depress? Which is coming from below, that is sternohyoid, superior belly of the omohyoid, they are depressor, or previously mentioned muscle they call elevators. বুঝতে পারলি? আর একটা এলিভেটর হচ্ছে জিনিওহয়োড। There are three muscles that is coming from that is attached at the posterior margin of the thyroid cartilage, posterior border of the thyroid cartilage. You have not heard the name. One is salpingopharyngeus, stylopharyngeus and palatoopharyngeus. They are the muscles that are attached to the posterior border of the larynx. Right? These are all called extrinsic muscles. Now come to the intrinsic muscles. Intrinsic muscles lies within the larynx. Their function is abductor or adductor of the vocal fold. Abductor or adductor of the vocal fold, or lengthening or shortening of the vocal fold. And there are some muscles which acts as a sphincter. Laryngeal inlet, they act as a sphincter. So these are the muscles that the intrinsic muscles of the larynx. Now come to the, here you see, it is, what type of section it is? What type of section it is to the larynx? Sagittal section, very good, sagittal section. Sagittal section, very important diagram. You should practice this diagram, sagittal section. Now after muscles, now come to the membrane. There are two important membrane. One membrane is called quadrate membrane or quadrangular membrane, and another is known as cricofocal membrane. Here you see, this one is a quadrangular shaped, that's why it is quadrate membrane, and here you see this is the cricofocal membrane. Cricofocal membrane, it is the other name of which membrane? Cricothyroid. তাহলে cricofocal membrane, it is the part of the cricothyroid membrane বা cricothyroid ligament যা বলবি. So these two membrane are very important because they form the framework of the larynx. Now this quadrate membrane, now boundary of this quadrate membrane. Before that, let us talk about the arytenoid cartilage. Arytenoid cartilage, here you see, this is the arytenoid cartilage. Arytenoid cartilage, this is the arytenoid cartilage. How it looks? Arytenoid cartilage is a pyramidal shape. Arytenoid cartilage is pyramidal shaped cartilage. Where it lies? The foundation stone, which cartilage is called foundation stone? Cricoid cartilage. Cricoid cartilage, you can compare it with ring. It is actually signet ring shaped structure. Signet ring shape. Here you see. I am drawing the posterior aspect. Signet ring shaped, the posterior aspect, this is the quadrangular part, and there is a ring, there is an arch, anteriorly there is an arch. আংটি দেখেছিস তো? আংটি কেমন দেখতে হয়? আংটির মতো. It is a posterior aspect. On its lateral part here actually articulates the arytenoid cartilage. Articulate the arytenoid cartilage. This arytenoid cartilage is pyramidal shaped. So it has a base, apex, posterior surface, medial surface and anterolateral surface. It has base, apex, posterior surface, medial surface and anterolateral surface. Right? So I am seeing the posterior surface of the arytenoid cartilage. I am seeing the posterior surface of the arytenoid cartilage. Right. Now come to the thyroid cartilage. Thyroid cartilage, it is convex or concave. Here lies a depression like this. It is concavo, convex. This is the lamina. This is the lower margin. It is extended upwards. It is extended downwards. It is extended upwards. It is extended downwards. They are called horn. Horn of the thyroid cartilage. This is called horn of the thyroid cartilage. This is the lower horn. This is the upper horn or cornu of the thyroid cartilage. This is the Adam's apple, right? Now here you see there is a circular facet. With that facet, the lower cornu will articulate here. Lower cornu will articulate here. Right? Lower cornu articulate here. Now come to this picture. So this is the anterior aspect, this is the lateral aspect. Right? Now here you see. This is the arytenoid cartilage at the lateral part of the upper border of the cricoid cartilage. Now here you see it has been cut sagittal section here, right? Now I will show you now I will see the cartilage patch is complete. So if you are asked to enumerate what are the cartilages of the larynx, you will say that there are paired and unpaired cartilage, 3 unpaired cartilage, number 1 thyroid cartilage, number 2 cricoid cartilage, number 3 epiglottis, and paired cartilage is arytenoid, cuneiform and corniculate, right? Now come to the membrane. There are 2 membranes. One is quadrate membrane and one is cricovocal membrane. What is the nature of this membrane? It is fibroelastic membrane. Now come to the muscles. Now before discussing the muscles, you should know the action of the muscles. The muscles and their attachment. Number 2. If you do not know the attachment of the muscle, you will not be able to appreciate the function of the muscle. Now what is the muscle? Number 1 muscle, very important muscle in our body. One muscle very important in our body. Which muscle? Can you tell me? In our body there is a very important muscle, probably the most important muscle in your body. If your tongue is not there, you will be able to survive. You will live. You can live without tongue. What is the most important muscle of our body? If that muscle is paralyzed, what will happen? It will close the vocal fold, the abductor of the vocal fold. That muscle is posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle. Right? Posterior cricoarytenoid muscle, it is the abductor of the vocal fold. So it is most important muscle. If both muscles are paralyzed, then severe dyspnea will develop. If you do not tracheostomy, patient may die of choking. Right? Short note আসতে পারে এটা, cricoarytenoid muscle short note. Now this muscle takes origin. This muscle takes origin from. Now see the posterior cricoarytenoid muscle. Posterior cricoarytenoid muscle. Here you see, this is the arytenoid. This is the posterior surface. So this arytenoid has got one process that is called muscular process, and this process is called vocal process. And another, as it is triangular, it has an apex and base. Apex is not displayed here as it is the horizontal section. Apex is not displayed here. Only you can see the laterally, that is the muscular process, and anteriorly, that is the vocal process. Right? Now this muscle, posterior cricoarytenoid muscle, comes from the posterior aspect of the lamina of the cricoid cartilage. একটু আগে যেটা আমি দেখালাম, যেটা কোয়াড্রাঙ্গুলার শেপের, যেটা রিংয়ের সঙ্গে. So from its posterior aspect, this muscle takes origin and it is inserted into the lateral muscular process of the arytenoid cartilage. Right? So this is the posterior cricoarytenoid muscle. Another muscle you see, that is called lateral cricoarytenoid muscle. Lateral cricoarytenoid muscle, this muscle takes origin from the anterior arch of the cricoid cartilage. Cricoid cartilage, ring shaped cartilage, it has an anterior arch and posterior lamina. This is the anterior arch, is a posterior lamina. From the anterior arch, this muscle, takes origin, and it is passing posteriorly. It takes origin from the anterior arch and passes posteriorly. And where it is attached, inserted, it is inserted at the anterior aspect of the muscular process. Right? Anterior aspect of the muscular process. These two muscles very important, because if this muscle contracts, what will happen? This muscle, if contracts, what will happen? From this picture, you can easily tell. If this muscle contracts, lateral cricoarytenoid muscle, it takes origin from the anterior arch and it is inserted into the anterior aspect of the muscular process. Right? These two muscles, if it contracts, then what will happen to the vocal process of the arytenoid cartilage? To which direction it will move? Medially or laterally? Huh? Medially. That means it is the adductor of the vocal cord. Or if this muscle posterior contracts, then what will happen? It will move laterally. So it is the abductor of the vocal cord. বুঝতে পারলে? Clear? Now these two muscles. Here one muscle. This is the posterior cricoarytenoid, or it is the lateral cricoarytenoid. These two muscles actually act in opposite direction. One is abductor or one is adductor, right? Another muscle is there. Here you see, from the posterior aspect, another takes origin. This muscle is the transverse arytenoid muscle. It is transversely oriented from the posterior surface of the arytenoid cartilage. It takes origin and it is inserted to the posterior surface of the another arytenoid cartilage, right? It is called transverse arytenoid muscle. If this muscle contacts, what will happen? If this posterior, transverse arytenoid muscle, if they contact, what will happen? এটা এখন দেখতে যাস না, তাহলে বুঝতে পারবি না। আমি যেটা বলছি আগে শোন, তারপর বুঝে নে, তখন এটা পড়বি, নাহলে বুঝতেই পারবি না বাড়ি গিয়ে। এই যে posterior arytenoid, transverse arytenoid muscle, if contact, what will happen? Arytenoid cartilage is moved closer together, so it will again adduct the vocal cord, right? So if you are asked to say what are the adductors of vocal cord, you should mention two muscles. One is posterior cricoarytenoid and one is transverse arytenoid, right? Now come to the another muscle. There are several muscles here, you see, that are coming from the posterior aspect of the thyroid cartilage. This is the posterior aspect of the thyroid cartilage. This is the thyroid cartilage posterior aspect. মাসলের নাম পড়া যাচ্ছে? এই মাসলের নাম পড়তে পারছিস? যতগুলো মাসল আসছে এখানে পেছনে, কী কী মাসল? এটা arytenoid muscle, triangular muscle, arytenoid muscle, or thyroid cartilage, Adam's apple. So all these muscles should memorize. কী কী মাসল? না মনে হয় থাইরয়েড কার্টিলেজ arytenoid, তাহলে thyroarytenoid and vocalis, আর একটা thyroepiglottic. Thyroepiglottic actually it will thyroepiglottic means from thyroid cartilage it will go along the lateral margin of the epiglottis. So and these two muscles which is going from the lateral anterior surface of the arytenoid cartilage to the posterior aspect of the thyroid cartilage. One is vocalis and one is thyroarytenoid. Actually vocalis muscle is the detached part of thyroarytenoid muscle. देखो, and here you see the anterior part of the vocalis muscle is attached to the vocal cord. It is important. This very important. Why it is attached anteriorly? Now, if this muscle contracts, thyroarytenoid muscle, if this muscle contracts, what will happen? The vocal cord will be elongated or shortened. Bolo, shortened. That means it will relax the vocal cord. তাহলে one muscle is tense the vocal cord and one muscle is shorten the vocal cord. মানে tensor and one is called relaxer. One is called tensor, one is called relaxer. So this muscle is called relaxer, right? Now if vocalis muscle contracts, what will happen? anterior part is attached to the vocal ligament. So if it contracts, anterior part of the vocal ligament will be stretched and posterior part will be relaxed. বুঝা গেছে? This is the vocal cord. This muscle এর এই পার্টটা লেগে আছে এখানে. This part is free. If this contracts, as it is attached here, this portion will be stretched and this portion will be relaxed. The same muscle causing anteriorly tensor and posterior relaxer. When this muscle will come to your use, when you modulate your voice, modulation of voice, then this muscle will come to your use, right? What muscle is called safety muscle of the larynx? Which muscle is called safety muscle of larynx? Safety muscle of larynx. এখন তো বললাম the most important muscle in your body. One single most important muscle in your body. If this muscle is paralyzed, if you are not done, tracheostomy will die, which will causing the abduction of the vocal fold. That muscle is posterior cricoarytenoid. Posterior cricoarytenoid muscle is called safety muscle of the larynx. Right? Now come to there are two other muscles. One is called oblique muscle and another is called thyroarytenoid muscle. These two muscles you have to know from where it is coming and from where it is going. The epiglottis looks like an leaf shaped. So leaf में क्या होता है? एक इसका stem होता है. Stem is attached to the posterior margin of the thyroid cartilage and lateral margin is free, right? From this lateral margin, now I will show it from another picture, the muscles of the larynx. The laryngeal muscle कितना भाग किया गया? Broadly, एक extrinsic and intrinsic. Extrinsic means external to the larynx, but a laryngeal cavity. What are they? That you have seen in your cadaver. All these muscles, they are long step muscles. They are extrinsic muscle of larynx, which is attached to the thyroid cartilage. Here there is an oblique ridge. That oblique ridge is attached. One muscle is known as sternothyroid. Superior below the omohyoid at a sternohyoid. Right? They are coming from below upwards and coming from above downwards. Stylohyoid. From here geniohyoid, mylohyoid. They are coming from above. All these muscles are external muscles of the larynx and internal muscles. Out of that internal muscles, I mentioned 3 or 4. Number 1, most important muscle is the posterior cricoarytenoid, another lateral cricoarytenoid. One is called transverse arytenoid. You see from one posterior surface of the cricoid arytenoid cartilage going to the other posterior surface of the arytenoid cartilage. This is a transverse arytenoid muscle. These are the muscles of the internal muscle of the larynx. Right? Now I am showing other muscles of the larynx. Next day I shall again discuss. Today I just gave you the some outward knowledge. You should study, otherwise you will not be able to understand. You should study and you will come and try to understand. বুঝতে পারলি? একটু ডিফিকাল্ট আছে larynxটা. Where it will come to your use? If you go to the anesthetist, sometimes you have to introduce the laryngeal tube through the laryngeal inlet. If you don't know the anatomy of the laryngeal inlet, what will happen? If you try to introduce the tube, endotracheal tube instead of larynx, if you introduce just behind the larynx, there is esophagus, then what will happen? Operation successful, patient is dead. পেশেন্ট তো অপারেশন করে যাচ্ছে সার্জেন, তারপরে দেখা গেল যে পালস নেই, মেরে দিয়েছো তোমার একটু হলের জন্য। সুতরাং তোমাকে এটা জানতে হবে ল্যারিঞ্জিয়াল ইনলেটটা। আজকে জাস্ট একটু আউটওয়ার্ড ডিসকাশন হলো, বাট টুডে ইউ লার্ন নাম্বার ওয়ান, হোয়াট ইজ ল্যারিংস? ল্যারিংস primarily designed for safeguard the respiratory tract. It acts as a watchdog. It helps in phonation. It helps in respiration. It helps in deglutition. Right? It consists of several cartilages, membranes, muscles, and joints. Number হচ্ছে cartilages. There are two type of cartilage. One হচ্ছে single cartilage and bilateral cartilage. Epiglottis, unpaired. Epiglottis and thyroid and cricoid. Paired cartilage, corniculate, cuneiform, and arytenoid. Right? Out of this cartilage, most important cartilage is cricoid cartilage. Cricoid cartilage is the only cartilage of the respiratory tract. Whole respiratory tract. It is the only cartilage. It is form a complete ring. Otherwise, all other cartilages, they are incomplete. Right? Now, out of this, the joint it forms. Number one joint it forms the inferior cornu of the thyroid cartilage with the cricoid cartilage. So this joint is name should be crico. This is arytenoid. আর তাহলে থাইরয়েড কার্টিলেজ অ্যান্ড ক্রিকয়েড, তাহলে ক্রিকোথাইরয়েড জয়েন্ট, অ্যারিটয়েড কার্টিলেজ জয়েন্টস উইথ দ্য ক্রিকয়েড কার্টিলেজ, তাহলে ইট শুড বি নেমড অ্যাজ cricoarytenoid joint. And one joint is formed at the apex of the cricoid cartilage. There is a small cartilage that is corniculate. Corniculo-arytenoid cartilage joint. All these three joints are what type of joint? Fibrous joint, synovial joint, or cartilaginous joint? Not cartilaginous joint, though it is cartilage, but it is not cartilaginous joint. All are synovial joint. Movement is necessary. If there is no movement, then how will you speak? There are two important membrane. One is quadrate membrane and one is cricovocal membrane.